In a neighborhood with no medical clinics and the highest pollution rates in Michigan, health can seem out of reach. Hunger isn't the only silent crisis our neighbors face, and that's why the Perry Center goes further. For 32 weeks a year, we offer free weekly health screenings, blood pressure checks, blood sugar checks, nutrition guidance, and wellness education, all provided by volunteer nurses from local universities. During the pandemic, we were able to get partners to provide several COVID-19 screening and vaccination clinics in this community. Providing free health screenings can be crucial for early detection, preventative care, community trust, and addressing significant health disparities.
So we are student nurses at Madonna University, and we just come here to take people's blood pressures and their blood sugars and answer whatever health questions that they have for them.
A lot of people have come in asking what they can do to lower their blood pressure because when we take it, it is often sometimes high, so they always are interested in how they can lower their blood pressure and what they should do if they are in a situation where their blood pressure is really high and they're not feeling well.
Okay, so we talk a lot about like healthy eating and exercising, reducing your stress, and then we also get a lot of questions about like diabetes as well. So kind of explaining that to people. Well, as you know, like this zip code has the Marathon oil refinery here. So there's a lot of air pollution and just health problems in general. There's not really any grocery stores around or like healthy food places. So I do find that people come back a lot just with hypertension and questions about that and what they can do to fix that. And also just concerns with the air pollution and that sort of thing. So.
Yeah, and like they want to know how they can lower their blood sugar and their hypertension. But unfortunately, just because of limited resources, they need to eat healthier. But unfortunately, the stuff that they can afford, such as canned foods, those often actually have a lot of sodium in them. So it doesn't necessarily help them, even though financially and just what's available here, that's all that they are offered.
Do you have a lot of conversations about nutrition?
We try to, yeah. Kind of depends on the person, on how receptive they are to the conversation, because some people are, older and they don't really want to change their diet or that sort of thing. And also it's understandable because it can be hard to get access to that healthy food. But yeah, we try to.
Yeah, I think they definitely want to make a change because they want to know that information. But unfortunately, if they don't have, local produce or groceries that they can take and they're forced to go to the dollar store and forced to, have canned soups, even if they advertise that they're less sodium, just because it's a can, there's a lot of preservatives and ends up being a lot of sodium in them. I think one thing that I've definitely noticed between the Perry Center and the Kennedy Center is that the residents here, they want change. They want to know what they can do. They're not necessarily just asking for objects or just asking for food because they want to be able to do it themselves. They want to know what changes they can make.